ADHD is a neurogenetic disorder, so we're looking at a chronic delay in the development of a normal trait, the trait of self-control, stopping and thinking or inhibiting. And this is not about bad parenting. This is not about that the parent did something wrong. This is not about diet. It's really just how the person is, the way that they're built. There are two subtypes of ADHD. There's a subtype that's associated with more hyperactive and impulsive behavior. And for these children, the first sign is typically hyperactivity. The child just simply behaves too much, and there's an excess amount of verbal and motor behavior. And that's noted in their difficulties with stopping and thinking, with waiting their turn, whether it be in line, in conversations, and play activities. They'll show a lot of interruptions. They will have a hard time resisting distractions, and they just tend to do the first thing that pops into their head without thinking about the consequences for their behavior. For the more inattentive subtype of ADHD, that is not associated with impulsivity, these symptoms are going to include resisting distractions, and the child is going to have a harder time when they have to independently follow through on tasks. They're going to have a harder time with organization. They're going to frequently lose things or misplace things, and just have a hard time with staying on task and focused. If you're noticing impairment in your child's academic functioning, family functioning, peer relations, or all of the above, then I would recommend scheduling an appointment with your pediatrician to discuss what is typical child development and what is the severity of symptoms that we're seeing. If there's a question about ADHD, then I would recommend that the parent obtain a referral from their pediatrician for a psychologist so that they can have a thorough evaluation completed before initiating any kind of treatment. Chief among the treatment for ADHD is just education for the parents and for school staff on the symptoms and management of the symptoms. And there is some good research to support the use of stimulant medications and behavior modification. I would strongly recommend that any child with ADHD be receiving some behavior modification treatment, which is going to include parent training. And it's important to remember that when you're doing behavior modification, this is more about helping the child be successful at the point of performance. Because we're dealing with a difficulty with inhibiting and stopping and thinking, they're going to need additional support in the setting where these symptoms occur.